Okay, these are your aligners. This is your aligner set. This is your first appliance. First, I will try aligners on your teeth and then explain you later on. Okay?
Yes.
Okay, just see.
Yeah.
They are completely invisible.
Yeah.
You cannot make out. They have a shiny surface, so it will look much better. Your teeth will look much better. Okay, and no one will come to know that you are undergoing a treatment. Okay, while removing, there is a certain way you have to remove it.
Okay.
So with the help of both index finger, there is a slot on your molars, so you have to pull it down. And the for lower, you have to use your thumbs, and on molars, you have to push it upwards. So try it once. Just pull, it won't break, nor your teeth will come out. Yes, perfect. You will have this typical noise.
Okay, and for lowers?
Same. Perfect.
Okay.
Okay.
I need practice for this.
Yes. So while wearing, first we will identify how to identify these aligners. So obviously the one with the bigger teeth is the upper one, the one with the smaller teeth is the lower one. So while wearing, it is very confusing how to wear, because we are for first time we use mirror to see, so it is very confusing. So simple step, take your upper one, two ends towards you and teeth marking towards upside. Same for lower. Okay, two ends towards you, tooth marking down. So please try. So although you find this instruction very silly, but this is very important instruction, because whenever patient takes a appliance and he goes or she goes in front of a mirror, it is very confusing and it takes them a lot of time. And the first step with the clear aligner, they lose the confidence because they cannot wear such a simple appliance. So though this step is you think silly or instruction is silly, please do that. It is very effective. Okay, yes. Now the next thing, patient will observe that aligners are not fitting completely, because there will be a gap between teeth and the aligners. Because this camera is away, you cannot see this, but there will be a gap between teeth and the aligner. That is because there is a computerized or CAD/CAM adjustment is given for the correcting teeth. So the aligners won't fit completely. And what patient does, he tries to or she tries to push it further, but it won't fit. So the next instruction you have to give is, please make your head rest. See, this aligner has got three sides. So the computerized adjustment is being given in this aligner. So it won't fit completely. Okay, so from three sides, only two sides will fit. So while wearing, you have to wear this appliance and push it backwards like this on back teeth. Never ever push on the front teeth. If you push over here, the appliance will come out from either right side or left side. So whenever there will be a slight gap, it will, you only know that there will be a gap, but the other person or other people you meet, they will never come to know that you are wearing this appliance. So don't worry about it. Okay. Same for the lower. Usually lower fits better than the upper one, because lower teeth are smaller and they are much flexible compared to upper because of the smaller size. So always lower fit better than the upper one. This always happens with everybody. Now you will have two difficulties for 2 days. The first is a speech, difficulty in speech, because suddenly your all spaces are closed with the aligners and you are not used to it. So the first thing you have to do is the practice. Okay. So for today, when you go home, take today's newspaper go to your room, and from first word to last word, you have to read a newspaper loudly.
Okay.
So with that practice, your pronunciation will get clear. So it's right now it's 6 p.m. So you have to wear this appliance till you sleep. Do not wear today while you are sleeping, because it is your first day. So it will very difficult for you to wear this appliance and sleep. So for first 2-3 days, you are not supposed to wear it at the nights.
Okay.
Tomorrow morning you will be wearing this appliance since morning when you get up till you go to your office. Tomorrow and day after tomorrow, you are supposed to wear this appliance whenever you are at home only, because your speech will get clear within 2-3 days. Till that time, you are not supposed to wear this appliance while you are going to office. Otherwise, all secret that you are wearing, you are correcting your teeth with the aligners will be no longer a secret because of your slurred speech or blood speech. Okay. The next thing you will observe is there is lot of salivation. So salivation is because this is a foreign body. Although this is appliance is correcting our teeth, but our brain do not understand that. It just understand there is something in the mouth, and there is a natural process whenever something food bolus or anything we take into the mouth, salivation increases. So after 2-3 days, whenever you are used to this appliance, your salivation will come down to the normal. Okay. So for 2-3 days you have to wear this. You have to wear this appliance for 24 hours.
Okay.
Except while eating, drinking and brushing. So we may use to eat maybe 2 to 3 times or 3-4 times, and for tea, coffee or cold drinks we may drink it 5 to 6 times. So in all 2 hours we cannot use the appliance. So in all we have to use this appliance for 22 hours per day. Okay. There should not be much exceptions. Yes, 1 or 2 exceptions are acceptable, but only 1 or 2 exceptions. Okay. So try again once and wear it again. Perfect. Now it is much easier because this is the second time. With 3-4 times your practice, you will very used to it.
Yeah.
Okay. Okay. Now for cleaning, you need to have a brush.
Okay.
And you just have to wash it under tap water.
Okay.
So you don't need a hot water or super cold water. Always clean your appliance under tap water with the help of the brush, like this, like tap water is running and you have to clean it. Okay. For first 10 days you will be wearing this appliance, and this is the whole set for a month. I prefer to give whole set for a month. So for first day they will be wearing this. There are dates are specified over there. See, the first is 1st January. Today is 31st December. So whenever you are giving appliance to the patient, so don't count that day. Always write a date which is next to that day. So today is 31st December and the date is written over here is 1st January. From 1st January to 11th January, the patient will be using the first aligners. Okay. Whenever you will finish your first aligner, remove that aligners and keep in this box. Don't throw them ever away. Then take a next box, take it out your next aligners, and same for the 31st. Okay. From 21st Jan to 31st Jan, you have to wear the third appliance. Whenever you are coming over here, you are supposed to wearing this third appliance in your mouth. Because many times what happens, patients thinks that they are getting a new set of aligner, so they keep their aligner at their home. Because we have to see that aligner, whatever adjustment is been given in that aligner is been done in teeth or not. Okay, by seeing that appliance fitting, we come to know that whatever adjustment is given, it is expressing all the teeth or not. Okay, so you are supposed to wear. And do remember, you are never supposed to throw these aligners ever. Okay. Sometimes we need to go back to the back stage or the previous stage. So always keep these aligners. Don't ever throw them away until you finish your treatment. Okay. Or unless we tell them to discard them. Okay. Pause. So these are the same instructions. Whenever you will reach your home, go through it. Okay. Now we will check again. So please wear your aligners. Okay. Now I will just have a check. Take your head rest. Yes, they are perfect. Is there something hurting you or somewhere it is hurting you?
Little bit.
Little bit over here. Okay. So whenever you check the appliance, always ask the patient, because sometimes the aligner looks, they are fitting very good, but sometimes patient will come to know that it is hurting over here. So please show me over here.
Yeah.
On the cheeks or on the gums?
Gums.
Okay. So please remove it. So if patient complains that her teeth or her aligner are hurting on the gums, then take a Vanguard plier. Just grab the edge of that appliance and just fold it slightly. Not much, slightly. That's it. And if the complaint is reversed, that if that edge is hurting towards cheeks, then take it inside. Okay. The second instruction you can give it to the patient. If you find out that it is hurting somewhere and there is a sharp point, you can file it at your home with the help of the filer on the nail cutter. You can just file over here. Not much, just slightly. You can give 10 to 12 strokes and it will get smoother. Okay, that's it. If you have something more trouble, then you can always contact us. Okay. The next problem arises is about the fitting. Sometimes when patient tries the aligner and they comes out, okay, there can be two problems. The first, aligner is itself loose. Okay, the fitting of aligner is not great because the 3D printed model, if they are not accurate or they haven't printed on the high accuracy, the aligner won't fit, it will come down. The fitting of aligner is 90% or 80% and aligner is coming down, then you can use a undercut making plier and make undercuts in interdental areas over here. Okay, from palatally and from buccally, for lower from lingually and from the buccally. The second problem, patient is complaining that aligner is loose, but when you check, the aligner is not loose. The aligner is overcorrected. So what happens? It is too tight and it pops out. For the popping out movement, patient says that it is loose. So patient don't understand that it is popping out, that means it is more tight than required. So also check that once, that if it is popping out, it is over tight, then you have to inform lab that this appliance is over tight. This usually happens when you have a patient whose canine is getting corrected. Okay, if they are blocked out canines, or if you are moving canine distally or mesially, what happens? Canine is exactly at the center and it acts as a fulcrum. So what happens? The canine acts as a fulcrum and it shakes the appliance like a seesaw. Okay, so the aligner tends to come down or come out of the mouth. So always remember, if you are moving canine mesially or distally, the patient will have that popping action. Okay, in that case, you can use a denture adhesive in the aligners and tell patient that you have to use this denture adhesive powder every day. Okay, that's it for all the instructions. I wish you best luck, and I have given a complete demo. These are the same instruction I am giving to the patient every time. There are many more instructions, but these instructions are very sufficient because you give lot of instruction to the patient, patient don't follow. And if you give very less instruction, still patient don't follow. So you have to be very precise in number of instructions given to the patients. Okay, I wish you best luck. I wish you the success in giving clear aligners.